So yes, so we are going to see Caley John letter. So this is a case note. So after getting a case note, first one we will be seeing a writing task. First one. So write a discharge letter to Miss Cork. Miss Cork, the manager of nursing home, where Miss Caley John is a resident. Okay. So this is then it would be after discharge. So this is an what known case. So it is a known case. So we are updating the health status. So name had been given. So we have to write sincerely at the end of the letter. Okay. So first thing, you are a senior nurse. Okay, you are a senior nurse at Balcon Hospital, where Miss Caley John was admitted after a syncope episode. Okay, so today's date is 18/6. So we are writing this date. So Miss Caley John, so date of birth they have mentioned, so we will be prefer this. So lives in Malcolm for 3 years. Okay, this is not needed, so this is updated. Social history is not this needed because it is a known case. So previous medical history is not needed, though. So this is an known case, and she is getting a lisinopril, etc. All these things. So we are writing a manager, nursing home manager. So we don't know whether he is a medical profession or non-medical profession. So we will be avoiding this also. See, this is a lisinopril, mentolin inhaler. This is these types of drugs which she had been taken for previous history. So no needed. So aspirin needs to be continued. So aspirin is the current medication, so which needs to be written. Okay, so hobbies are all not needed. So coming on to the admission, so 16/4/2019 she had been admitted after a syncope episode. After her syncope episode, okay, dizziness for 2 days and 3 episodes of syncope in last 3 weeks with palpitation. Okay, all the symptoms she have. So therefore ECG they have taken, tachybrady syndrome they had been diagnosed. So first paragraph we will be writing this. Pacemaker had been placed on the very next day. Okay, after 17, after 2 days, so 19 she have developed a stroke, and they have taken MRI which had been shown acute ischemic indicator. So they have started thrombolytic treatment. Okay, so on after around 2 months, okay, four and this is 6, after 2 months she has partial progress because she had stroke. So she have partial progress, slur speech. Currently she is having yes, today's date is 18. Okay, currently she is having partial progress, slur speech, comprehensive improvement. She have steady improving, prepared for discharge. Okay, this is the letter. So what is the discharge plan now? So we are writing to the manager. Care for ADLs we have to write. There have continue physiotherapy, home arrangements like home rails, occupational therapist to consult. Okay, speech therapist, okay, once in a week. These and all needs to be recommended, and monitor patient. Okay, monitor for she eats, drinks. Okay, so according to speech language therapy, be aware thickness to be used to all the drinks until advice otherwise by the salt. So this is important. So this is present medical history. In this we will be writing for the first purpose. Present medical history we will be writing. Then directly we will go to recommendation paragraph, because past medical history and all not needed because it is a because it is a known case. So we will move on to the letter. Okay, we will move on to the letter. Today's status. We will be writing the today's date. So today's date, what they have mentioned as 18 6 means June or July? June. Yes, 16 June 2019. Okay. Miss Cork manager. Manager nursing home. Okay, then dear Miss Cork. Okay, so regarding Miss Caley John. So we are preferring date of birth. So 15 March. What day? 15 March 1939. Okay, so we are coming on to the purpose paragraph. I'm writing yes, I'm writing this letter to update. This is very important. So this is a known case. This is a common sentence for updation letter. I'm writing this letter to update the health status of Miss Caley John, who requires we after the discharge we are giving the care, who requires continuing care, and she wants a monitoring at your facility. So she is in her facility. So yes, facility. So she is diagnosed with, so currently she is having the present complaints of stroke. This is the management is mainly because of the stroke, not for any tachybrady syndrome. Please be careful in that. So currently she is having the complaints of stroke, not previously she have tachybrady syndrome, but she is currently having the problem of stroke. Okay, diagnosed what we have diagnosed with stroke. So as a result of acute ischemia and tachybrady syndrome. So if you are practicing many letters, you came to know how to write or how to connect all these things. She is discharged today. So this is the purpose paragraph. So now we are expanding the purpose paragraph. So what is the expansion? So we are elaborating what they have been done in their admission. That is the explanation paragraph. So Miss second name we will be, so Miss John was, so I'm rolling my camera. Okay, Miss John was admitted to our facility on 16 April 2019 following 3 episodes of syncope in the last 2 weeks and dizziness for 2 days. Okay, this is the first thing. So subsequently what they have done, subsequently Subsequently, an ECG was taken and she indicated for tachybrady syndrome. Okay, so for which in hospital persons, what they have done, for which a pacemaker was placed on 17th, that is so date we should not mention, on the very next day, on the very next day. Okay, so what happened next second day? Okay, so then after 2 days, what happened to her after 2 days? After 2 days, after 2 days, she had stroke. Then after 2 days, she had stroke. She had stroke. Full stop. Consequently, an MRI has had taken. Consequently, an MRI had taken, which shows acute ischemia. Okay, therefore, thrombolysis treatment was prescribed. So currently, she has partial progress and slurred speech. See, so many contents are there. Sometimes the body of the paragraph will be getting confused for us. So be careful while connecting all those things. So slurred speech. Okay. However, she is steadily improving. So moreover, so no need to add however and moreover in a one sentence. It will not be nice. Okay, so recently, so we have to write that medication history here. Recently, she is she started with aspirin, 75 mg, once a day, which needs to be continued after discharge. So this is the elaboration of the main purpose paragraph. So finally, this is a known case. So we are, so this is a known case. We are directly going for the recommendation paragraph. So it would be appreciated if you could provide assistance for her activities of daily living. This is simple, activities of daily living. Then so what they have, then the term, that home arrangements we have to write. It is important to provide a rearrangements. See, I'm giving a partial idea over this content. While you are writing in that OET paper, please be please be neatly you have to write. Okay, so you will be writing in a 2B pencil with eraser, so no need to be hurry burry. You can write casual. So rearrangement for the home with home rails, and we can continue her what is the spelling of physiotherapy? Yes, physiotherapy along with occupational therapist. Need to be consulted for her needs. Kindly monitor her when she eats and drinks. So anything we have to be so we will check once. Yes, and some more points we have to write, like speech therapy we have to write. Okay, in addition advise speech and language therapist who advise okay who visit once in a week to nursing home to record her. Okay. How to record her progress. Then one last point about her eating pattern. Okay, so this is the last point of note. Something we have to write by connecting. Be aware of the thickness be aware of thickness which needs to be used in all drinks until advised by the speech and language therapist. So it is a medium to, moderate to difficult level letter. So there are so much of connectors will be there, lots of points are there, we can't, so each and every points are different situations, so we have to careful while connecting all those things. Okay, but you have to connect all the points carefully. So this is the final. If you have any queries, please do not hesitate to contact me. Yours, the name had been given, yours sincerely. No punctuation should be seniorness. Okay, yeah, this is the overall letter. So if you have any doubt on some, please comment on my box. Thank you.